In the pursuit of the American ideal of universal equality, America must address the issues that prevent equality. One of the issues preventing equality among all American citizens is the disparity of rural populations in regards to access to health care. Health, a human right, is a primary concern among all Americans, and thus, America has the utmost duty to maintain equality within the realm of health care. Although the public health care system in urban American populations is well established and accessible, rural communities lack the support found in urban centers. Rural American communities lack an effective public health care system as a result of physical distance between rural homes and nearby hospitals, the immense time required to reach hospitals, and largely inadequate health care facilities. One of the main causes for the disproportionality between rural and urban healthcare is the physical distance between rural inhabitants and the nearest hospitals and healthcare providers. As a result of the low population densities in a rural area, healthcare providers are forced to provide to a large region of their community. In the rural city of Van Horn, Texas, for example, only one doctor served as the primary physician for people living within an 11,000 square mile region. To add, many of the hospitals are already seeking public funds or money from foundations, which we will talk about in a later slide. But when a hospital fails, the community also ends up losing the medical professionals who worked in them. Throughout America, hospitals are clustered around urban centers. As a result, rural areas are barren in regards to public health care facilities. In Texas, as seen in the map shown, hospitals and other healthcare facilities are found almost exclusively within San Antonio and Austin cities, leaving Kerrville, Fredericksburg, and especially Jackson vulnerable to medical emergencies. Ultimately, this imbalance of hospital vicinity between urban and rural communities exemplifies the rural population's struggle with accessible healthcare, as any medical emergency in rural area is significantly more dangerous than those in urban areas. Because of the large distances between rural homes and medical centers, the time required for any rural inhabitant to reach a hospital is significantly greater than those in an urban center. While some city dwellers may argue that traffic and urban sprawls would increase the time to reach a physically close medical center, the sheer distance rural residents need to cover leads to a travel time greater than most urban emergencies. As found in a Pew Research report, the average time to reach a hospital in urban areas is around 10.4 minutes, while the time to reach a hospital in rural areas is around 17 minutes. Especially in the matter of medical emergencies, a difference of 7 minutes between urban and rural patients is a great disparagement for rural inhabitants. So, since rural homes are, on average, further away from medical centers and require longer travel times to reach those centers, rural communities are stuck with disproportionate access to health care. Pulling the previously mentioned aspects of medical center density and travel time, urban centers are additionally better off than rural communities in their health care due to the ability to easily travel to an open hospital. Since not all hospitals are open for 24 hours, patients that arrive at a closed hospital must go to another one. However, this creates a vastly different outcome for urban and rural residents. Specifically, there is an open hospital within 3.5 minutes from the closed urban hospital, yet there is an open hospital within 18.7 minutes of the average rural hospital. Rural residents are thus susceptible to more health complications and further sufferings purely due to the inaccessibility of healthcare facilities in rural areas. In addition to the rural disparity of poor spatial design of hospitals, the rural disparity is evident in the quality of care and sophistication of medical facilities. Hospital and medical facilities, mostly privately owned companies, often lose money in rural areas due to the previously mentioned lack of access by residents. According to a National Healthcare Finance report in 2016, 113 rural hospitals have closed since 2010, with 18% of them in Texas. And since 41% of rural hospitals operate on a negative profit margin, there is little incentive to improve the state of hospitals and even continue operating at all. The state of the rural hospital clearly emphasizes the lack of access of rural residents, creating a double loss scenario when hospitals are forced to run as cheap as possible or not at all, while residents are stuck with poor hospitals or forced to travel further for a competent one. As a result of the negative profit margins found in rural Texas hospitals, many of those still operating at all are greatly inadequate. As seen in the American College of Emergency Physicians 2014 National Report Card, Texas received an F in access to emergency health care. Significantly, this rating has been maintained since 2019, meaning the rural disparity of health care is not new. This relationship between rural populations and the lack of health care thus extends across America in most rural environments, as supported by the previously referenced graph from Pew Research Center data. Overall, the surface-level issues of rural health care create a set of further disparities. Rural inhabitants simply live too far away from medical centers to rely on it effectively, thus reducing the medical center's traffic and its profit. This leads to a lower quality of care, thus further reducing rural inhabitants' access to proper health care. In all, having investigated the rural disparity of accessible health care, there is a clear relationship between rural, urban, and suburban communities and access to available healthcare facilities. Starting in the physical distance between rural homes and healthcare facilities, many rural communities simply must travel for too long to rely on those facilities. However, in urban communities, there is a high density of healthcare facilities, reducing the stress from mass emergencies and the obligation to maintain operation for 24 hours. Rural medical centers are thus more inclined but not required to remain open all hours of the day, thus reducing their profit margins and the quality of care provided. The ultimate result of such rural disparity is the relationship between rural and urban communities regarding healthcare. There is a prominent imbalance of medical facilities between such communities, and that imbalance leaves rural communities with an inadequate source of health care.